Buprenorphine is a partial opioid agonist used for management of severe pain that is not responsive to alternative treatments. Also used for maintenance treatment of opioid addiction. In this video, let's find found. What is buprenorphine? What is buprenorphine used for? Contraindication. What are the side effects of taking buprenorphine? How does buprenorphine work? How to use buprenorphine? Buprenorphine is a partial opioid agonist used for management of severe pain that is not responsive to alternative treatments. Also used for maintenance treatment of opioid addiction. In this video, let's find found. What is buprenorphine? What is buprenorphine used for? Contraindication. What are the side effects of taking buprenorphine? How does buprenorphine work? How to use buprenorphine? What is buprenorphine used for? Buprenorphine is available in different formulations, such as sublingual tablets, buccal films, transdermal films, and injections, alone or in combination with naloxone. The buccal film, intramuscular or intravenous injection, and transdermal formulation are indicated for the management of pain severe enough to require an opioid analgesic and for which alternate treatments are inadequate. The extended-release subcutaneous injections of buprenorphine are indicated for the treatment of moderate to severe opioid use disorder in patients who have initiated treatment with a single dose of a transmucosal buprenorphine product or who are already treated with buprenorphine. Injections are part of a complete treatment plan that includes counseling and psychosocial support. Sublingual tablets and buccal films, in combination with naloxone, are indicated for the maintenance treatment of opioid dependence as part of a complete treatment plan that includes counseling and psychosocial support. Contraindication. The only true contraindication to buprenorphine use is a hypersensitivity reaction to it. Its use requires caution in patients with respiratory depression and gastrointestinal obstruction. What is buprenorphine used for? Buprenorphine is available in different formulations, such as sublingual tablets, buccal films, transdermal films, and injections, alone or in combination with naloxone. The buccal film, intramuscular or intravenous injection, and transdermal formulation are indicated for the management of pain severe enough to require an opioid analgesic and for which alternate treatments are inadequate. The extended-release subcutaneous injections of buprenorphine are indicated for the treatment of moderate to severe opioid use disorder in patients who have initiated treatment with a single dose of a transmucosal buprenorphine product or who are already treated with buprenorphine. Injections are part of a complete treatment plan that includes counseling and psychosocial support. Sublingual tablets and buccal films, in combination with naloxone, are indicated for the maintenance treatment of opioid dependence as part of a complete treatment plan that includes counseling and psychosocial support. Contraindication. The only true contraindication to buprenorphine use is a hypersensitivity reaction to it. Its use requires caution in patients with respiratory depression and gastrointestinal obstruction. What is buprenorphine used for? Buprenorphine is available in different formulations, such as sublingual tablets, buccal films, transdermal films, and injections, alone or in combination with naloxone. The buccal film, intramuscular or intravenous injection, and transdermal formulation are indicated for the management of pain severe enough to require an opioid analgesic and for which alternate treatments are inadequate. The extended-release subcutaneous injections of buprenorphine are indicated for the treatment of moderate to severe opioid use disorder in patients who have initiated treatment with a single dose of a transmucosal buprenorphine product or who are already treated with buprenorphine. Injections are part of a complete treatment plan that includes counseling and psychosocial support. Sublingual tablets and buccal films, in combination with naloxone, are indicated for the maintenance treatment of opioid dependence as part of a complete treatment plan that includes counseling and psychosocial support. Contraindication. The only true contraindication to buprenorphine use is a hypersensitivity reaction to it. Its use requires caution in patients with respiratory depression and gastrointestinal obstruction. Dose: moderate to severe pain. 0.3 mg 4/IMQ6HR, may be repeated once, up to 0.3 mg, if required 30 to 60 minutes after initial dose. Also see administration. Opioid dependence. Induction, sublingual tablet. 8 mg SL on day 1, then 16 mg SL on day 2, continued over 3 to 4 days. Maintenance, buprenorphine naloxone combination. Switch to buprenorphine/naloxone combination for unsupervised maintenance. For dosing, see drug monograph for buprenorphine/naloxone. Safety advice. Buprenorphine is pregnancy category C. There is limited data in humans, but potential benefits may warrant use of the drug in women despite potential risks. That's all the information about buprenorphine we collected. Thanks for listening. Do not forget to like, share, and subscribe for the HeInfo channel if you like this video to update more health information.